Welcome to the training of rights of individuals receiving mental health treatment. Let's start off with finding out what the Illinois Mental Health Code is. So what exactly is the Illinois Mental Health Code? The Illinois Mental Health Code was first written in 1970 as part of the Illinois Compiled Statutes Section 405. It has been amended many times since 1970. The Mental Health Code is utilized for protections for persons with mental illness and/or developmental disabilities. It also provides definitions and directions to most facets of mental health patients. Lastly, the Mental Health Code provides law of the rights that mental health patients have and that we must adhere to when taking care of them. The beginning section of the Illinois Mental Health Code, Section 405, are several important definitions. Out of these definitions, the following ones that we're going to review are consent, restriction, rights, mental health facility, involuntary admission, petition for involuntary admission, and the IGAC, which is the Illinois Guardian Advocacy Commission. The first one's consent. Consent's permission for something to happen or agreement to do something. Compliance in or approval of what is done or proposed by another. Restriction, a limiting condition or measure, especially a legal one. The limitation of control of someone or something, or the state of being limited or restricted. The next one is rights restriction. With respect to any rights, any bona fide third-party reservation, holdback, limitation, or condition, binding under applicable law or contractually or unilaterally imposed by a third party, and relating to the manner in which such rights may be exploited. Rights. Rights are legal, social, or ethical principles of freedom or entitlement. That is, rights are the fundamental normative rules about what is allowed of people or owed to people, according to some legal system, social convention, or ethical theory. The next one is mental health facility. Mental health facility is defined as any licensed private hospital, institution, or facility or section thereof, and any facility or section thereof, operated by the state or a political subdivision thereof for the treatment of persons with mental illness, and includes all hospitals, institutions, clinics, evaluation facilities, and mental health centers which provide treatment for such persons. The next one is involuntary admission. Involuntary admission is an admission to an inpatient psychiatric facility by means of a petition and a certificate. The next one is petition for involuntary admission. The petition for involuntary admission, also known as the petition, is a legal document that is completed and utilized to hold a patient for a mental health assessment to determine if an inpatient certificate will be completed. And the last one on the sheet is Illinois Guardian Advocacy Commission, which is the IGAC. The IGAC protects and enforces the rights of individuals with mental illness, developmental disability, or physical disability. As you previously heard me talk about in the slide before, about a petition for involuntary admission. Now it's time to ask the question, what is a petition for involuntary admission? The petition for involuntary admission, also known as a petition, is a legal document that has qualifying information indicating that a person may be in need of inpatient psychiatric treatment without the patient's consent. So I should note that this applies only to patients 18 years of age or older, because there is no involuntary admission for pediatric patients. Next, the petition is filed with the circuit clerk of the court for the county for which the patient is being held, and must meet the burden of proof for meeting inpatient criteria. The petition also holds the patient for transport to an emergency department to be assessed by a qualified examiner who is a medical doctor, psychiatrist, psychologist, psychiatric nurse practitioner, licensed clinical professional counselor, or licensed clinical social worker to determine if an inpatient certificate will be completed. Lastly, the petition can be completed by anyone over the age of 18 years old. How I kind of describe this to people is if you notice that somebody may need an evaluation, like they're not acting right, or something just seems to be off, or they're having problems attending to their ADLs and their own needs, it may be time to fill out a petition to have a mental health assessment completed. That petition will end up getting the patient into the emergency department to have that assessment. So what exactly is inpatient criteria? Inpatient criteria is defined in the Illinois Mental Health Code if one or all of these things are met. Number one, a person with a mental illness who, because of his or her illness, is reasonably expected, unless treated on an inpatient basis, to engage in conduct placing such persons or another in physical harm or in reasonable expectation of becoming physically harmed. Essentially, you'll hear us talk about saying if that person is an imminent risk to themselves or somebody else. Number two, a person with mental illness who, because of his or her illness, is unable to provide for his or her basic needs as to guard himself or herself from serious harm without the assistance of family or others, unless treated on an inpatient basis. 3. A person with a mental illness who refuses treatment or is not adhering adequately to prescribed treatment, because of the nature of his or her illness, is unable to understand his or her need for treatment, and if not treated on an inpatient basis, is reasonably expected, based on his or her behavioral history, to suffer mental or emotional deterioration, and is reasonably expected after such deterioration to meet the criteria of either paragraph 1 or 2 of this section. Regardless of involuntary or voluntary status, all mental health patients have rights. It's important to know that the commencement of services for mental health start when the patient has been medically cleared. Per the Illinois Mental Health Code, patients being held for involuntary admission or evaluation retain the rights to the following. They have the right to designate a family member or other individual to participate in the treatment plan. They also have a right to decide preferences regarding emergency interventions. And they have a right to notification in writing of the side effects, risks, and benefits of treatment, as well as alternatives to proposed treatment. Physicians shall determine and state in writing whether the recipient has the capacity to make a reasoned decision about their treatment. Patients also have the right to unimpeded and private conversations, and the right to refuse medications unless imminent physical harm to the recipient or others, and no less restrictive alternative is available. Patients have a right to choose restraint use. Once used in a 24-hour period, restraints may not be used again during the next 48 hours without the prior written authorization of the facility director. This must be documented in the appropriate medical chart along with orders. There will also be momentary periods of physical restriction by direct person-to-person contact without the aid of material or mechanical devices, accompanied with limited force, and that are designated to prevent the recipient from completing an act that would result in potential harm to himself or others, and shall not constitute a restraint, but shall be documented in the recipient's clinical record. These are known as momentary periods of hold. The facility also has to contact two designated persons within 24 hours regarding admission if the patient chooses to do so. Another right that the patient has is the notifying of their admission to the IGAC, which is again the Illinois Guardian Advocacy Commission. They also have the right to restrictions of rights must be given if this occurs. If any form of restriction occurs to these patients regarding any of these rights, the patient must be notified. As mentioned in the previous slide about some of the mental health patients' rights, these rights can also be located on the Petition for Involuntary Admission on pages 4 and 5. Pages 4 and 5 of the Involuntary Admission Petition must be completed within 12 hours of admission. If any of these rights are restricted, you must fill out a restrictions of rights forms, which we'll take a look at in a little bit. As previously stated on the slide before, the petition for involuntary admission contains the rights of the admittee. Here's the pages 4 and 5 that I just talked about. On page 4, you'll notice the rights of the admittee and a list of those rights that you have to adhere to. If any of those rights are violated, you must complete a restriction of rights form. On page 5 here, for the petition for involuntary admission, you'll see the IGAC locations. Rockford is our closest one to CGH Medical Center. At the bottom of page 5, you're going to go ahead and complete that for the language that you are presenting this to the patient, the date and time. You're going to sign it, put your current title, and then print your name with the title. Go back to page 4 for the petition for involuntary admission, the date and time of admission to a mental health facility or a psychiatric unit. Now, if you remember from this one of the second or third slide that was in there, it had talked about what the definition of a mental health facility was. And this entire hospital is a mental health facility. The technical time of admission would be when the patient arrives at CGH Medical Center. The petition completed date and time will be when the patient is being held for an evaluation. Don't forget to sign, print your name, and put your title on page 4. Now that we discussed a petition for involuntary admission and how to complete pages 4 and 5, the ultimate question is, what do I do with this form? To reiterate, the petition for involuntary admission needs to be filed with the circuit court within 24 hours of admission, which is the date and time on the petition, along with one inpatient certificate. The petition is good for 24 hours from admission, and that's the date and time on the petition, to obtain a mental health assessment by the qualified examiner. Once the patient is assessed by the qualified examiner, an inpatient certificate will be completed if the qualified examiner feels that the patient meets inpatient criteria. The inpatient certificate needs to be completed within 24 hours of that petition date and time. Once the first inpatient certificate is completed, you have 24 hours to have a second inpatient certificate completed. Essentially, within 24 hours, a psychiatrist needs to evaluate the patient to determine if inpatient criteria is still appropriate for this patient in the least restrictive means possible. If so, and it's determined that the patient does need inpatient criteria, a second inpatient certificate needs to be completed. We are done at that point with the inpatient certificates. They do not need to be renewed every 24 hours after that. It's important to know that all documents need to be filed with the circuit court of the county to which the patient is being held. Once filed with the circuit court, the documents need to be sent to the IGAC also, which is the Illinois Guardian Advocacy Committee. So, essentially, we file it to the state's attorney's office or the circuit court. Once we receive the okay that they have filed it with the court, then we need to send the paperwork to the IGAC via fax. Additionally, what happens after that? So after it's been filed, within 7 business days of filing with the circuit court, a hearing will be set to determine if the patient will remain inpatient for treatment or discharged immediately. All mental health patients have the right to choose their emergency preference. This brings us to the emergency preference form. We will see a copy of that form on the next page. However, before then, it should be noted that when we talk about restraint for the emergency preference, we are referring to behavioral restraints rather than medical restraints. Per the Illinois Mental Health Code, patients have the right to state a preference for the type of emergency intervention that they prefer. This will usually be completed within the emergency department, which is the form that I spoke of and we will see in the next slide. All other floors should make sure that this is completed if a patient has been transferred from the emergency department to your floor. Again, please double check to make sure that this form has been completed, and if not, make sure it gets completed when they get to your floor. Here's an example of the emergency intervention preference form that I was previously speaking of. Note that it says, at times it may be necessary for staff to use medications or restraints to help prevent you from injuring yourself or others. Do you have a preference? And yes, the patient does get to state whether or not they have a preference or not, or if they have no preference at all. The choice of restraints that we have for behavioral restraints or physical restraint or medications for treatment of symptoms, or no preference. This form does not have to be signed by the patient and should be signed by the RN that is asking the question, along with the date and time. This form gets filed within the patient's medical file. As previously stated in the slide before, the emergency preference form should be filed with the patient's medical chart. The information regarding a patient's preferences should be included in the nurse-to-nurse handoff also. This form does not get sent to the state's attorney or the IGAC. So you've heard me talk about restrictions a few times. Now it's time to talk about the types of restrictions. Some of the types of restrictions that we see the most are emergency enforced medication. Emergency enforced medication is medication that's administered against a patient's consent in an attempt to alter a patient's behavior outside of their medical needs. The next one would be seclusion. Seclusion is placing a patient in a room where they are unable to exit the room at will. And the last one listed here is material or mechanical restraints, which are nylon restraints or the restraint chair in the BHU. There are also other types of restrictions of rights, such as restricting phone privileges. There are many different types of restraints and reasons why they could be having to be restricted. Anytime that you are taking away a patient's rights that would normally be given to any other patient on the unit, that is a restriction. And with that, you should be completing a restrictions of rights form. The restriction of rights form that I just mentioned, or more formally known as the Notice Regarding Restricted Rights of Individuals, is located here on this slide. Pages 1 and 2 are here. Notice that page 2 is the notice regarding the restricted rights of individuals. This is a notice that's given directly to the patient, along with page 1. But page 2 is the most important because it lists out what their rights are. Let's go back to page 1. Page 1 contains patient's personal information, where they're at. The unit that you're going to have on there is a unit to where the right is restricted. And then the next part 1, is the physical hold, restraint, seclusion, emergency medication restrictions part. Date and time. Don't forget in the long box there, well, you're going to mark first which restraint you did or restriction that you did. And then you have to do a detailed description as to what warranted that restriction of right. Also, please note in there any less evasive means that you were attempted. For example, if you tried to verbal de-escalation, if you tried seclusion, which is a restriction in itself, that had to lead up before a physical altercation took place or a physical restraint. Put in there in detail everything that you did leading up to that point and also the patient's behaviors. Also, the following question underneath of part 1, it asks, in accordance with the Mental Health and Developmental Disability Code, the individual designated his or her preference for emergency intervention if circumstances arise as indicated below. And so you're going to mark whether or not the individual indicated no preference, whether the individual preferences was utilized, or whether the individual preference was not. So that goes back to that preference page as to whether or not they would prefer restraint, medication, or had no preference. Part 2 would be the other restriction part. So patient has the right to refuse many different services unless within the behavioral health realm. They also have a right to refuse them through the medical part too, but we're going to focus on the restrictions of rights for behavioral patients. Part 2 is also something that can be utilized if you have a restriction placed on certain rights. Remember, if I talked about the phone restrictions, some of the other ones that are mentioned here that we would typically see within the behavioral health unit or throughout the hospital might be to manage personal hygiene. Let's say a patient is a direct threat to themselves or somebody else, and you have not allowed them to take a shower or adhere to their hygiene because they would somehow harm themselves or somebody else. The other one would be to be allowed communication. That's the telephone mail visitation. So sometimes you'll have to restrict a telephone if they're going to break the phone, if they're going to use the phone to hurt themselves or somebody else, you may have to restrict that. Or if they're continuously calling and calling and calling 911 or another number, to the point where you would have to articulate why in detail that you are restricting that patient's rights. Part 3 applies to 1 and 2. First part says, a copy of this notice was given to the individual in English, Spanish, or designated another language, but you have to write it in. Then remember, you have to ask if you want anybody to be notified that a restriction of rights occurred. They can list up to 2 people that you would have to notify. They also says, I certify this form is complete. So you're going to put your name, date, and time, and then your signature along with your printed name and title on this form, indicating that you gave copies of this notice to the individual. So that's going to include pages both 1 and 2 of this. Gets a copy afterwards. Now that we talked about the restriction of rights form, the question is, what do we do with it? The restriction of rights form, if the patient is involuntary, should and must be sent to the Whiteside County State's Attorney and the IGAC. If the patient is voluntary, the form should be completed and placed in the patient's medical chart. There are some restraint policy updates that are important to relay. The first one is, per the Illinois Mental Health Code, restraint use is limited to 2 hours, after which time a new order is needed. Additionally, restraints cannot exceed 16 hours in a row. If restraints are discontinued, you must have authorization from the shift coordinator to reapply within a 48-hour period. Also, the provider and nursing documentation must include information about behaviors requiring the use of restraints, along with documentation about the other alternatives that were tried with response. Finally, if medications are used, a patient must receive written info on medications, including side effects.